Hi, I'm Jessica. Today I wanted to teach you about a really cool treatment technique for speech sounds called prompt. I can never remember what prompt stands for, so I have to look it up. It stands for prompts for restructuring oral, muscular, phonetic targets. This is a 3-day workshop that I took a year and a half ago, and it has completely changed the way I think about treating speech sounds. Here is an image of the different places on the face where I have learned to touch to activate muscle engagement for all the different speech sounds in English. The concept is that by pairing physical touch with what the sound is supposed to sound like, I can actually rewire a child's brain even if they're not actually able to say the sound themselves yet. Prompt still benefits the kiddos who are unable to yet make those sounds. There's lots of evidence to support the efficacy of this treatment method, and it looks really cool, and I think it's a lot of fun. I get to squish people's faces, so I just wanted to share a little bit about it. For example, I was really interested to learn that there are 4 different jaw heights for different vowel sounds and different consonant sounds. I also learned that the maximum jaw height, level 4, should be about as wide as an individual's 2-finger span between their teeth. So if I insert 2 fingers between my teeth, that is the jaw height I should be at when I say the vowel ah, which is a low back vowel, all the way down here. Conversely, when we say the vowel e, that is a high front vowel, and that is at jaw height 1. Sounds that happen around jaw height 2 include the neutral vowel unstressed, as in the word the. We have the vowel as in but or mud, and we have the vowel a, as in say, day, way. Other sounds around jaw height 2 include voiced th, mm, voiceless th, your h sound, and your sound. Sounds at jaw height 3 include the like head, bet, bed vowel. Our velar sounds, the sounds at the back of our tongue, also are at jaw height 3. K, k, k. Turn on your voice. G, g, g. Now keep the back of your tongue up so the air comes out your nose. And finally, our jaw gets its very widest for the vowels ah and ah, like bat and hot. So we learned in my speech sound assessments video that not only are there different jaw heights for different sounds, but there are also 4 different sections of the tongue that are engaged and contracted and in use when we're saying different vowels and consonants. The very tip of our tongue is the anterior portion, this part. And so sounds that happen there include your p, b, m, f, v, e, t, d, n, s, z. We also have the speech sounds ch, j, l, and v. All of those are with the tip of your tongue. So I would touch right under the chin at mylohyoid A. That is the point of lingual contraction. The sounds at mylohyoid B, or just behind the tip of your tongue, I guess it would be analogous to where your tongue blade is. Here's my handy dandy Excalibur Infinity Stone tongue depressor that I use to show clients about the different parts of our tongue. So your tongue blade is right here behind the tip of your tongue. And so that is where the point of contraction is in that region of the tongue for the unstressed neutral vowel as in the vowel like but, and the a vowel like way. Mylohyoid C, as you can see, is the widest part of the muscle under the tongue. The sounds that require lingual contraction at mylohyoid C include sh, zh, as in head, and as in hat. And finally, mylohyoid D has our back tongue muscles contracted. So our speech sounds at mylohyoid D include oo, as in put or cook, o, our vealers, k, g, ng, the aw, as in more or Boston. I don't know if I'm even making that correctly, but it is slightly different than the ah, as in hot. I wanted to use my cute little lizard puppet here as my model to show you examples of what prompt words can look like when I'm actually working with a kid. I'll show you a phrase that I'm working on right now with one of my kiddos who has apraxia of speech. Okay, so I'm going to prompt the phrase I want. So I pull his jaw down for the I, make him smile for that E, I, then the word want. We have to round the lips, so I'd grab his cheeks, make his lips go round. Ooh, wah. I have to touch his nose to signal that the air is supposed to come out the nose. Mm, that's how you say I want. I want. I want. What does he want? Food? I have to push his lip up under his teeth, squeeze his cheeks to get that lip rounding. Ooh. And then tap the tip of his chin to get that tip of the tongue to contract. D. I want food. He wants cookies. All right, let's help him say it. Is with the back of your tongue, the vowel. He doesn't have lips, so I can't really show it on here, but you're supposed to grab this part of the lips for uh, uh. So, cookie, make him smile. Still smiling for S. I want cookies. Maybe he wants something a little healthier. I think he wants some strawberries. So, st raw. For the b, I have to grab the lips, squish them together, and pull. B. Bay. Is with three fingers at the widest part under your tongue, and I'm physically pushing that tongue up. Rees. Let's put it all together. I want strawberries. What about bananas? I want bananas. And there's your mini tutorial on what prompt therapy can look like. Of note, only speech language pathologists are qualified to do all three levels of prompt once they have taken the training course. People who have not been trained in this are not supposed to do it. Communicative disorders assistants are allowed to do parameter prompts, or the most basic ones, which include things like make a gun with your finger, put your chin in the crook of that corner, and then you can pull the jaw down and push it back up to help clients get those final sounds at the end of words like cat, mom, pop. Communicative disorders assistants are also able to do broad retracting or big smile. So that's where you take your fingers and push those dimples back. Take your fingers, pull those dimples forward to get ooh and shh. And another example of a parameter prompt is the H sound. The parameter prompt for H is I have to put one hand on the client's chest, one hand on their back. Because H has no vocal fold vibration, it's mostly the sound of air getting squished between vocal folds that are closer together. So when I see the client take a big breath, I then push on their chest bracing with their back as well. So I'm actually helping them get the airflow needed to get that H sound. Ha. And then I touch their voice here to get them to turn on their voice. Ha. Ha. I hope you found prompt as interesting as I did. And if you look online, Prompt has a registry of prompt certified speech language pathologists who can provide this type of treatment to your client. Thanks for watching. Have a wonderful day.